couples generally they'll ask difference between IUI and IVF. I am Dr. Neeraja Fertility Specialist from Hyderabad. So there are two treatments available which are with proven success. One is IUI, intrauterine insemination. One is in vitro fertilization, that is IVF. There are clear-cut indications and with proven success rate. So for IUI generally, if there are any male semen parameter abnormalities like oligospermia, if the count is low, if the motility is low, generally for this type of mild endometriosis, newly married couple, for these kind of patients, generally we'll tell them to go for IUI. If the parameters are abnormal, severely abnormal, very low count, with very little motility, severe endometriosis, elderly couple, or if they are opting for donor egg, or if they are opting for surrogacy, for this kind of patients, we will tell IVF. In IUI, the majority will be ovulation induction drugs, that is medicines, oral medications, plus or minus we will add 3-4 injections to increase the quality of the egg, followed by regular scans to see the egg growth, and we will time the ovulation. On the day of ovulation, we will collect the husband's sperm, we will purify the semen, and we will insert into the uterus here. So this entire path will bypass in IUI. The sperms will move from uterine cavity into the tubes. They'll catch the egg. Fertilization will happen in the tubes. Embryo will form here. After 3 to 4 days, embryo will go into the cavity and later it will implant into the uterus. So this is the main process of IUI. In IVF, generally we will give daily injections for almost 10 to 12 days. Followed by follicular scan. We'll check the growth of the eggs. After attaining maturity, we'll give anesthesia to the patient. We'll collect all the eggs. At the same time, we'll collect husband's sperms. We'll make them fertilize in the lab. That's called as test tube. We'll catch the egg, we'll hold the sperm and we'll make them fertilize. We'll prepare the embryos and we'll grow the embryos for 3 to 5 days. We'll see the quality. We'll assess the quality so that we can tell the success rate. So 1 month, we'll prepare the embryos for IVF patient. And next month, we'll make them transfer. That is called as frozen embryo transfer. So when compared to fresh transfer, the success rate with frozen embryo transfer is 5% more when compared to fresh transfer. So the success rate varies between 45 to 55% depending on other criteria of the couple. So there are clear-cut indications for IUI and IVF. IUI is very simple, office-based procedure with no complications, no side effects, no diet restrictions. So they can work, they can go to office. Will give minimum supplements in IUI, that is progesterone, vaginal supplements. In IVF, they need to undergo one invasive procedure, that is egg pickup under general anesthesia. There is the only procedure in IVF. Remaining all embryo transfer, these are very simple without anesthesia. But in IVF, they need some more medications, some supportive medications. We'll give progesterones, injections and capsules, gels, depending on patient's wish. So when compared to IUI, IVF has 3 times more success than IUI. With 3 IUIs, the success rate is around 15 to 20%. When compared in IVF, the success rate is 45 to 55%. So there are clear-cut indications depending on the patient criteria, depending on other factors, depending on scan, depending on semen parameters, will guide patients towards IUI and IVF. Thank you.